Welcome to Hot Topic Tuesday. We have a special edition to talk about International Overdose Awareness Day featuring AADAP's Health Intervention Program.
Hi, I'm Terry Reynolds, Program Supervisor of the Health Intervention Program at AADAP. AADAP stands for the Asian American Drug Abuse Program. AADAP was founded in 1972 in the setting of a crisis overdose among Asian youth in Los Angeles. AADAP's HIV outreach program was started in 1998 to address the HIV/AIDS epidemic in vulnerable populations, including injection drug users. Through our efforts, we were successful in decreasing the rates of HIV and AIDS. Now in 2021, we address the newer crisis of drug use and overdose. The Health Intervention Program at AADAP works to prevent substance overdose by distributing free safe injection supplies, naloxone, and fentanyl test strips in Los Angeles County. August 31st is International Overdose Awareness Day. Since 2001, this day has been used across the world to spread awareness about overdoses, remembering those who have died, and combat stigma among people who use drugs. On this day, we hope to bring awareness in the prevalence of overdose, discuss what we can do to stop overdoses, and acknowledge the grief felt by those who have lost loved ones to overdose.
My name is Deborah Coulter, and I am the lead staff in our syringe service program. In 2020, 93,000 individuals died of an overdose in the United States. Beginning in March of 2020, there were an increase of overdose deaths in Los Angeles County, coinciding with the beginning of COVID-19 pandemic. Now, from March to December of 2020, there were 2,084 overdose in the Los Angeles County alone. Now, this is an increase of 52% from 2019. Methamphetamines and fentanyl were the top two drugs involved in fatal overdoses. And the two populations with the highest increase of drug overdose deaths during the pandemic were the Asian Americans and the African American people.
Acknowledge the role that systematic racism plays in overdose crisis. Thankfully, we are slowly moving towards correctively treating the overdose epidemic as a public health crisis with better resources and more compassion. Stigma and discrimination still exist among people who use drugs. The stigma is compounded by people of color who are often targeted by law enforcement and incarceration, when instead they need treatment and compassion. Black African Americans have the highest rates of overdose deaths compared to other ethnicities. As we work to prevent overdose and overdose deaths, we must take a social justice approach and fight to end systemic racism.
An overdose is a biological response to when the human body receives too much of a substance or a mix of substances. This can be accidental or intentional. People can overdose on illicit drugs, alcohol, prescription medications, and many other substances. The overdose will vary depending on the person, the drug, and the amount taken. If you know or suspect that someone has taken a drug, look out for drowsiness, nausea or vomiting, difficulty breathing, loss of consciousness, trouble walking, being unusually agitated or violent, enlarged pupils, shakes, tremors, or convulsions, hallucinations, or delusional thinking. An overdose doesn't always result in death, but it can.
Fentanyl is a synthetic opioid that's used in hospitals as a painkiller, but it can also be produced illegally and sold as a street drug. Fentanyl is 50 times stronger than heroin and is often found laced into drugs, which is a big part of the problem. People use the amount they normally would, not knowing that their dose was actually laced with fentanyl. Here's what to look out for with fentanyl overdose specifically. It hits within a few minutes or even seconds, and some people say that they actually start feeling symptoms even before they finish injecting. Some things to look out for are blue lips or fingernails, labored breathing, sometimes including gurgling sounds, stiffness, jerking movements that can look like a seizure, foaming at the mouth, confusion or dizziness, cold, clammy skin, pupils changing in size, nausea or vomiting, or loss of consciousness.
Here in AADAP, a health intervention program, we provide our clients with free fentanyl test strips. Within the fentanyl test strips, they help within their clients to test their drug if there's any fentanyl presence within their drug. The one thing you want to keep in mind is that you don't want to use alone. So within this extension number, Never Use Alone, within 800-484-3731, have yourself or a friend call this number so they could call a paramedic in case if you do have an overdose. But also, you should be one carrying Narcan, or your friend should be carrying Narcan as well, so in case if either one of you or yourself are in an overdose state.
Naloxone is a medication that reverses opioid overdoses. It's available as an intramuscular injection or as a nasal spray. If you think someone has overdosed and they are unresponsive, rub their sternum hard and shout their name. If they remain unresponsive, you should administer naloxone. When you're using Narcan nasal spray, stick it up their nose and spray it, just like a regular nasal spray. When you're injecting it, stick it in the fat of the arm or the fat of the leg, not in the middle of the chest. Either way, call 911. If the person is unresponsive, roll them onto their side. You may need to use more than one dose of naloxone.
AADAP Health Intervention Program. We know that harm reduction is an important philosophy to prevent overdose. We provide free fixed and street syringe services, naloxone, and fentanyl test strips. We must and meet clients literally where they are, whether it's in an office setting, a street corner, a bus stop, or even a homeless encampment. At the Health Intervention Program, we work with clients who are not necessarily ready for treatment and need low barrier services. We know that people need people, and we work every day to save lives and prevent overdoses.
Naloxone saves lives. People need people.